11's Calorama joins us now because Jackson is joining a long list of celebrity moms who are choosing to have kids a lot later in life, Cal.
Yes, she sure is. In fact, Jackson's rep is saying that she had a stress-free delivery. She's now resting comfortably with her family of 3. And according to the CDC, women having babies for the first time over the age of 35 is up by 23%. Doctors say they're seeing the trend in their office.
Janet Jackson just welcomed her first baby at the age of 50, but she's certainly not alone when it comes to women growing their family later in life. Actress Kelly Preston, John Travolta's wife, gave birth to their 3rd child at the age of 48. Halle Berry had her 2nd child at the age of 47. Supermodel Iman had her first child with David Bowie at 45. OBGYNs are noticing the trend. Moms are waiting a decade to even have their first child, and they're thanking modern-day science for making it easier.
Advanced reproductive technologies have allowed older women to conceive and to conceive safely.
Marianne met her husband at 30, married 6 years later, and had her first child at 37. She said it wasn't easy.
When you're doing a retrieval, you're doing shots in your stomach of the hormones. And then as it gets closer to a transfer, you're doing progesterone shots. It's sad to say, you almost get used to doing it.
Doctors warn their older patients of the risks carrying a baby after the age of 35.
Older eggs make mistakes. Instead of putting 23 chromosomes, they put 22 or 24, and that's how you end up with babies with chromosomal disorders like Down syndrome. At RMA of New Jersey, we have pioneered the use of chromosome screening of embryos. So we perform a procedure called comprehensive chromosomal screening when a couple elect to have this done, where we can actually take eggs and sperm into the laboratory, make embryos, and test the embryos before they're transferred back to mom.
Keep in mind, most healthy women who get pregnant must think about steps to ensure the baby's health for the full pregnancy. And Dr. Molinaro points out conceiving later in life hosts increased health risks for mom and baby.
Older women are at a higher risk for miscarriage. You know, some of that is chromosomal, so things like doing embryo screening, chromosome screening on embryos can actually help reduce the risk of miscarriage.
Lots of older parents consider in vitro fertilization, and most doctors in the United States say the success rate is low after the age of 45. But get this, the oldest woman to give birth is Rajo Devi of India, who gave birth at the age of 70.
And keep in mind, you heard Marianne talking about that reproductive technology, saying it sort of becomes her way of life when you're trying to get pregnant. And then, of course, you just saw Raja Devi from India. It took her 2 years to have a baby, Scott.